Hi, my name is Martha. I'm a sexologist based in Singapore and my company is called Eros Coaching. This is the second of 3 videos that I'm bringing to you talking about the issue of vaginismus. There are some facts and myths around vaginismus which I would like to address in this video. The first myth that I have for you is that a woman's vagina can be small. We have different shapes and sizes and angles with regards to the vagina, but the vagina as we know it is highly stretchable and expandable. It can even accommodate up to the width, in terms of width, the size of a baby's head. So that is how big it can expand to when the woman dilates and is ready to give birth. When it comes to the being too small, there is a misconception around the vagina being small to the frame of a woman's body being small. So small woman, small vagina. That's not necessarily true. So we need to correct that myth. The second myth is that the woman's hymen is still there and that's the reason why she cannot have penetrative sex. The woman's hymen is actually a very thin film that is probably eroded over the years because of exercise and all the stretching and fitness that we do. It may not even be there. The hymen is not at the entrance of the vagina. The hymen is inside the vagina. So in order for her to experience tearing of the hymen, usually it is confused with the difficulty to penetrate from the entrance. So the hymen is not what is causing vaginismus. I like to correct that myth right now. The third myth is that a woman only experiences this condition when she's trying to have intercourse. This is not true. A woman with vaginismus generally also has difficulty with inserting any other objects such as her finger, a sex toy, a tampon, or even when her partner tries to do penetration with his finger. This condition can be overcome with a little bit of training. The fourth myth is related to how some people think that only single women have it and married women don't. Married women can also have vaginismus. In the fifth myth, there is a belief that only women who haven't given birth can have vaginismus. This is not true. There are women who have secondary vaginismus where they have some kind of pain and trauma while giving birth and they have vaginismus as a consequence of this. This doesn't happen to all women, of course. The sixth myth is that vaginismus will go away by itself without any intervention. Vaginismus is actually highly treatable. A woman can overcome vaginismus very easily with some practice, discipline, patience, and some exercises. However, if she doesn't have the right kind of support, it will be very challenging to overcome it by herself. And this is the reason why coming to somebody like me, such as a sexologist, will be able to support her in moving on faster. So this has been the second video. I have an online training program called Sex Possible and I will talk more about it in the third video. In the meantime, keep loving, live life fully, and stay lovely. This has been Martha of Eros Coaching.